welcome to our Facebook Live event, and it's lovely to have you join us today. My name is Tola Lanyon, and I'm the CEO of Pretola Global Health. And with me today, I've got Jeremy Gaduskas and also Mary Duffy with us today to have a conversation about sudden unexpected death in epilepsy. And I'll go to Mary first to introduce herself to us.
Thank you for having me here today. Again, my name is Mary Duffy. I'm located in Chicago, Illinois, and I work for the Danny Did Foundation.
Thank you very much. Jeremy.
Hi, Tolu. Hi, Mary. Jeremy Gadauskas with Roe Foundation and Roe Global Health. Like Mary, based in the Chicago area, and excited to be on the call with you today.
Today, we're talking about sudden unexpected death in epilepsy. It's a global phenomenon, but really we'll be talking about it and also talking about the Masterclass events we've got coming up in a couple of weeks. So, Mary, and can you share a little bit of light about Danny Did Foundation and what you do to support people with epilepsy and also about SUDEP as well?
Sure, I'd love to. So the Danny Did Foundation was founded in Chicago, and it was founded by friends of mine. Their names are Mike and Marianne Stanton, and they lost their 4-year-old son, Danny, to SUDEP. SUDEP stands for Sudden Unexpected Death in Epilepsy. The name of the organization comes from the last line of Danny's obituary, which was written by his dad, and it stated, "Please go and enjoy your life, Danny did." So that's our goal. The foundation wants to do all we can to support those facing epilepsy so that they can enjoy life. And we do that by engaging healthcare providers, families, other advocacy groups, and general public to join us in our goal to protect people of all ages with epilepsy. We really have two main focus points at the foundation. First is to increase public awareness about epilepsy and the risks that accompany it, particularly sudden unexpected death in epilepsy. And second, an area of focus is to really stress the importance of early intervention during a seizure. We do feel if you're present and you can take action, you have a chance to keep your loved ones safe. Whether that's preventing further injuries or providing rescue meds or just being present, as no one should be alone during a seizure. We found that seizure detection devices can aid in intervention, especially if the patient's alone at night or when the family's sleeping. These devices can detect a seizure and sound an alert or send an alarm to a caregiver so that they can check on their loved one and make sure they're okay. So we also raise awareness and access to devices and technology that alert to seizures.
Thank you. And we'll come back to that in a bit, Mary. And Jeremy, can you tell us a little bit about Roe Foundation or Roe Global Health?
Sure. Well, Roe, or ROW, stands for Rest of World. And that's really kind of sums up the heart of our mission. We know that much of the world does not have access to inexpensive and effective treatments that could change millions of lives. So we work to improve the quality of care for people with epilepsy in under-resourced areas of the world through training, diagnosis, and treatment. And treatment comes in the form of medication grants, thanks to our social enterprise partner, OWP Pharmaceuticals, which go to our partner organizations all around the world. So today we have over 70 partners in 37 countries, and we're really proud to work with so many organizations and people really doing amazing work all around the world, like the two of you.
And we can testify to that. We've partnered with Roe Foundation and over the years, and really it's been phenomenal actually working with the organization to do this work, because you can't do it alone. You need partners. You need to be able to work with other organizations to be able to make the goals of actually creating more awareness about epilepsy and also meeting the needs of people with epilepsy in their local communities. And thank you for joining us today. Mary, I'll come to you here. Why is it important that we have a conversation about SUDEP? I'm quite conscious of the, for some people, it evokes emotional response, and there's some barriers in some communities about having a conversation about sudden unexpected death in epilepsy. Why is it important that we're even doing this at all?
Yeah, it's so important, and our goal is never to scare, or it's instead of frightening someone, to educate both everybody involved, the whole entire family, the healthcare, the clinicians, the team. Maybe it's best if I mention what SUDEP is, and then we can talk a little bit more about that importance. SUDEP is referred to as when a seemingly healthy person with epilepsy dies unexpectedly. There's no clear reason for the death that can be determined. Now, in many cases, an autopsy can be required, or is required, to rule out those other causes of death, but we know that that's not always an option. And if an autopsy is not possible, it's best to consider some common criteria to determine SUDEP. And I'll give you those criteria here. One is that the person has epilepsy, defined as recurrent unprovoked seizures. The person has died unexpectedly while in a reasonable state of health. And the death occurs suddenly and usually during normal activity such as sleep. And again, an obvious medical cause of death could not be determined. And that death did not result from status epilepticus or prolonged seizures. They don't know the precise reason or reasons regarding what causes SUDEP. It's still unknown. It's why it's so important that it continues to be talked about and researched. It can be frustrating. There's some main theories. One could be cerebral shutdown, or perhaps it's cardiac or pulmonary abnormalities. It also could be both, or multiple causes, and it could be that it's different in each case. So a lot of times people ask me about prevalence too when discussing SUDEP. And again, why it's important to have this conversation is because SUDEP occurs in 1 in 1,000 people with epilepsy. And that applies both to children and to adults. For people with seizures that are uncontrolled, however, the rate increases to 1 in 150 people. So seeking seizure control is critical. And you ask why it's important. Why are we talking about this? And I'll share the story of Danny's family. Before he passed, his parents had never heard of the word SUDEP. It was never a risk that was raised with them by their neurologists. And that lack of disclosure, unfortunately, is common. It's something that we're trying to change. We find out over and over from surveys that patients and caregivers do want to know, be informed, and be educated on this topic. And we also learned that it's typically only about 30% of neurologists that actually counsel patients. So that's a big disconnect that we want to meet. Without learning about SUDEP, Danny's parents were not given a chance to protect him. They don't know if that outcome would have been different for Danny, but they deserve that chance. And we believe parents throughout the world deserve that chance too. So this masterclass can help spread that awareness to all the families impacted by seizures, and they deserve that.
You're right, Mary. All the families, everyone, and even people with epilepsy, as much as they can understand, depending on their ages, need to understand the associated risks to, of their condition. It's really important. And I get it as a clinician myself. I understand, some of the barriers to it, why a clinician may hesitate, but then it shouldn't stop them as to having the conversation. And sometimes it's the confidence to be able to actually have the conversation, to broach this topic to the individual and to the families to say, we need to get your seizure under control because you are at risk of sudden death in epilepsy, and also because there are other multifactorial, conditions that could also put the person to be more at risk, depending on their epilepsy and factors associated with them. So it's really important, really. It's not just about seizure numbers. There are a whole lot of other things that could put someone with epilepsy more at risk of SUDEP. So it's important we have this conversation. And like we know, epilepsy is a global condition. So as it's happening in the UK that I live in, and I know, there are people with epilepsy in the US also at risk with SUDEP, and much more so those in lower middle income countries where there may be other, predisposing factors that put them more at risk as well. So it's really important that we have this conversation. I'm coming to you now, Jeremy. The question is, why is it important that Rowe Foundation and Danny Deed Foundation partner together to support putting together this masterclass for people in low and middle income countries?
Thanks, Tolu. Well, yeah, I think it's the right team to do this, right? We have a lot of respect and admiration for Danny Deed Foundation and their mission. Like we said, we're both based in the Chicago area, and while we have distinct missions, I think they're also very aligned, especially in this area of raising awareness through training and education around epilepsy, and including training clinicians and practitioners. As you know, Tolu, Rowe Foundation's been able to help support previous Pretola trainings, the EAMC courses, and we've seen the really rapid growth in the numbers of people you're reaching, the quality and effectiveness of the programs, the outcomes. So we shared an idea with Danny Deed about partnering to support a specific training in SUDEP, which is their focus area, and they jumped right in. I think that's why we're able to do this masterclass. So we talked about partnerships before. One of our great joys is building these types of partnerships, connecting organizations who can do more together than they could have done separately. So we're really excited about this one.
I'm quite excited about this one as well. As in partnering with Danny Deed, I had to go and also look at their values and their purpose and really aligned to what we do at Pretola, which is to share, create more awareness. And there is a need for that. We can't overemphasize the need to create awareness, the need to reach out to people in their local communities, the need to equip clinicians and non-clinicians alike, advocates, people supporting families, young people with epilepsy in their countries. They need to be equipped. They need to have the, up-to-date information so that when they reach out to people in their communities, they can actually give them the right information and support them appropriately. So we at Pretola Global Health, we're grateful. We're happy to, work with both organizations on this and putting together the masterclass. And also we're thankful to our speakers, our 3 speakers that will be teaching on the masterclass. That's Dr. Rohit Shankar, based here in the UK, a consultant, psychiatrist and a professor, and also Kim Morley, an epilepsy specialist nurse midwife based here in the UK, to actually talk about SUDEP risks to pregnant women before pregnancy, during pregnancy, and post, natal support as well. And also we have Dr. Eddie Chengo from Kenya joining us to also teach on this masterclass. So we're really looking forward to having the 3 of them join us on this training as well. And I'll come to you, Mary. Could you share some experiences of families that Danny Deed Foundation have worked with, as much as you can? Just share some experiences with us, for us to bring it more to life as to why SUDEP, having a conversation and having a better understanding about SUDEP is really important.
The majority of families, including the Stantons, have a real difficult grief journey. Because they feel blindsided. They question why they were not educated. They feel information was withheld from them. Families tell us, this really leads to a lot of what ifs. Had we known, would we have done something different? And that's not fair. We really want families to have all the information about epilepsy so that they can make treatment and behavioral decisions based on that knowledge. Going back to the question that you asked, Jeremy, this partnership, it was so important to us. Once we met Rowe, and you introduced us to Pretola, we knew we had to learn more. Your scope, your reach, it's something we couldn't do alone. And we feel it's a responsibility really to take advantage of all of these opportunities like this one and to share what we know. Discussions of SUDEP can lead to changes. And it can lead to better treatment. It can lead to lifestyle changes. A lot of positives can come out of it, including hopefully reduction in seizures. Again, when families say to us, we wonder, why aren't they telling us about this? We do understand that and we do appreciate this is a hard conversation. But we want both the clinicians and the families to feel empowered so that they can keep someone's life-saving measures, really. And the masterclass can really change that. You mentioned earlier, as a clinician, the barriers. And I just wanted to mention there is a website that we call a toolkit, and it's called preventingepilepsydeaths.org. It is a toolkit for clinicians to help them have these conversations. There is videos that they can watch, mock videos of families and clinicians having these conversations, these tough conversations about all the risks, including SUDEP. And there is some really just the topics that can be discussed during those appointments after an assessment to decrease your mortality risks. And both parties should be engaged in those discussions and take actions to reduce those seizures. And if you go to that website, you can see some of those examples, maybe seeing a specialist, making sure medication's been prescribed and taken as prescribed. And is it time for referrals? Is it time to make sure that somebody is assigned to the person, regardless of age, for supervision, maybe especially during nighttime? Do they have their seizure response plan? Is it shared with the community, the schools, really doing all they can to minimize those risks?
Thank you. And Mary, one of the important things you've just said right now is the partnership. Really, it is partnership between the individual and the person with epilepsy and their family and carers with the clinician. It's really important that that relationship, helps to promote, seizure reduction and management of risks associated with epilepsy as well. And Jeremy, I'll come to you now, because I know Rowe Foundation, you've done a lot of work, and you continue to do a lot of work across, countries globally, and you partner with a lot of organizations and clinicians alike as well. A question I'd like to ask is, what are some of the challenges or barriers that people with epilepsy may face that could increase their risks to SUDEP?
I think, like Mary said, we don't know exactly what causes SUDEP, but we do know the biggest risk factor is uncontrolled or untreated seizures, right? So if the stat I've seen is 1 in every 1,000 people with epilepsy are affected by SUDEP, the risk for those with uncontrolled seizures or untreated seizures is actually 1 in 150. Is what I've seen. So as a clinician, you probably know more about the kind of other risk factors that I've heard about, as we've talked about unsupervised seizures, early onset of epilepsy, maybe developmental disabilities or certain types of high risk seizures. But seizure control is really important, which is why we focus on treatment, especially in low and middle income countries where treatment hasn't been as accessible. And I know you're familiar, Tolu, with the global treatment gap, and I'm sure a lot of people who are watching us are living it or understand the reality of it. But just to put these stats out there again, 65 million people in the world live with epilepsy. 52 million, or 80% of people with epilepsy, live in low and middle income countries, where 3 out of 4 people can't access treatment. So that's 39 million people in the world with undiagnosed or untreated epilepsy, and that's 39 million people with uncontrolled seizures. So that puts that population at a higher risk of SUDEP, which I think just showcases the importance of this conversation, of many conversations that needs to happen, but a really important one in terms of being able to save lives.
Yeah. And thank you for that. And really made me remember a conversation we had with Dr. Dora Nkita. She's based in Uganda, and she's currently supporting the immigrant population. So families and children with epilepsy that have been impacted by war. So they've had to, move from one country as a result of conflict to Uganda. And the risks, when we had the conversation of what's going on there, how as a doctor and our team are supporting children and families in this environment where they have limited access to medication and limited access to healthcare, really breaks your heart. And you really want to be able to support her, to be able to have the knowledge and the skills to be able to have these conversations and also support them the most. So really this training, the masterclass training, reaches out to anyone, clinicians, doctors, advocates in the rural areas that can actually just join in. And that's the advantage of it. You don't need to travel to the UK or to the US, to Chicago to actually attend the training. All you need to do is just log in, register for it, log in, and, learn about SUDEP from some of the most experienced in the field. So really we're looking forward to this. And I do want to mention about the website Mary mentioned earlier. There's a toolkit for clinicians that can help to support you to have this conversation about SUDEP, because we really want everyone to be empowered. And just before we wrap up, I do want to go to Mary to ask, what's our purpose? Like, what's the main aim of what I know we've kind of hinted at it, but what's our goal of the masterclass?
I think you just summarized it pretty well. Spreading this interest, spreading the knowledge of SUDEP to different areas of the world, empowering clinicians to do more and have these discussions and do what they can to reduce those barriers, really help and join us at Danny Did to fill that SUDEP communication gap, because you can't protect somebody from something they don't know exists. And this class can help reach, educate on the seriousness of epilepsy, let people know that there's organizations like us three here today that are here to help. It's our responsibility to do this. We want people with epilepsy to be seen. We want them to be heard. So we're just proud to partner with Roe and with Pretola to offer this. It could be a potentially life-saving course.
People with epilepsy need to be seen and to be heard. Really important message here. Thank you, Jeremy.
Yeah, not much more to add. I think you've covered it, but I agree. I think knowledge is power, and the goal is to empower, like you said, clinicians, advocates, families, caregivers, anyone who's influential in the lives of people with epilepsy. So the more people who can be educated about epilepsy in general, but SUDEP specifically, like Mary said, I think the more lives can be saved, and that's the goal here.
It's important people are aware of risks. Also made me remember a story that a colleague and friend, always talks about, and she's got epilepsy herself. And I remember her saying, until when she had this conversation with a neurologist, and the neurologist basically told her, your life expectancy is if we don't get your seizures under control, you're at a higher risk here. And she said it was almost like a light bulb moment. Okay, what do I need? It's not to scare anyone, but it's actually to empower them to go, okay, what do I need to do to actually get this under control? What do I need to do? What are the risks, associated risks? And as a result of that, she ended up having surgery, which she never thought she would need, having surgery, and now her seizures are better controlled and the risks are better managed. So really, we want to empower people. That's the whole point of the training. We really want to empower people. We want people to come learn and also share about their experiences as well of what's going on in their communities. Because I'm based here in the UK, you're in Chicago, US. There are loads of stuff going on in Bangladesh, in Iraq, and in other countries that we would love to know about. And we always talk about the statistics. I am of the opinion that we've not gotten the statistics right. I don't think there's anyone that would say that we've got all the answers, because we don't have the answers. We need research. We need to get the data out. And the only way that can happen is if we engage with those actually doing the work on ground. So it's important we have this conversation through the masterclass and also through our Facebook Live chat that we're having today to create awareness about it. And with regards to the masterclass itself, it's going to take place on the 19th of August, so less than a month away. And it's free. Anyone can register for it. If you're a teacher, special education needs teacher, or anyone working with people with intellectual disabilities and autism, because we do know that in that population, epilepsy is quite prevalent as well, or anyone, an advocate, a carer working with people with epilepsy, feel free to sign up. It's on our website, www.pretolaghc.net/SUDEP Masterclass, and we'll put our website on the chat, chat as well. So you can just click on it and register. It is free to register, and then come and learn. with others. Come and learn from, come and hear and learn, and also get answers to your questions, because I'm sure you've got questions about it. Register. It starts at 9 a.m. BST to 1 p.m. So it's a chunk of a day, but really there's a lot to learn, and it's going to be quite interactive. So you're not just going to go without answers to your questions. You are going to get answers to your questions. So that's how you register for the training. I am excited. I'm excited about this, and it's about time. It's about time we do start to have conversations at a global level about topics that are important, like SUDEP. And by the end of it, I'm sure, lives and also epilepsy care will be improved, in areas and communities that the participants attended the training. Mary, any parting words from you?
Just to let everybody know, we're here, DannyDid.org. We're a place for support, to provide information, to provide resources. So we welcome everybody to reach out to us if you have any type of questions or want to continue this conversation. And remember to enjoy your life, Danny did.
Sam, you can find us at rowglobal.org. And also just want to say thanks, Tolu, for you and your hard work with Pretola and the reach that you're having and all the work training, putting together this training. And really, we've talked about SUDEP at a high level overview, but your experts are going to really bring lots of really good information and details that I'm sure I would learn a lot from sitting in on that training. So just so folks know that there's some experts that are really ready to educate. So thanks for all the work on that, Tolu, and Mary and Danny did. Thanks for supporting this and for the financial support and all the work that you're doing to raise awareness as well. We're just thrilled to see this happen.
Yeah, we are too. It's a great partnership, and we're excited to see the outcome. Thank you for all of your hard work, Tolu.
Thank you. And thank you for believing in us. Thank you for believing in Pretola Global Health. And thank you, Ro. Thank you, Danny. And hopefully, I do know that we'll be able to achieve our goal through this masterclass. And if anyone has got any questions, we'll take it. But if not, we're happy to answer questions. Feel free to put it in the chat box. We'll answer questions afterwards, or send us an email at info@pretolaghc.net as well. But then Danny Did Foundation, you can find them on social media. They're on Facebook, they're on LinkedIn and Twitter and Instagram as well. And also Row Foundation as well. You can reach out to them on all the platforms, social media platforms. They're happy to help and happy to connect, to support as much as possible. And do have a lovely day and take care of yourselves. See you soon.